All right, everyone. Thank you so much for tuning in and giving us your Wednesday night. Big welcome to our webinar, and this is a part of a series of presentations WholeHealth has been doing during COVID. One certainty around tonight's webinar topic is that as we probably already know as pharmacists, that pharmacy is going to become a lot more of a virtual place on a permanent basis after we kind of come out of the pandemic situation. So, I can honestly say that being in a head office situation, we get exposed to a lot of interesting and cool stuff that maybe the average pharmacist doesn't see on a regular basis. So what we're going to try and do tonight is we're going to try and share 4 very quick presentations with all of you tonight that we feel at WholeHealth that these are pretty cutting edge. And so we're pretty excited to present this to you tonight. It's a little bit different from what we normally do. And when James came to talk to me about this topic, I thought, wow, what a great topic to present to everybody. So once again, welcome to our webinar tonight. James, you can go on to the next one. My name is Dean Miller. I'm the president of WholeHealth, pharmacist like all of you. I'm going to be relinquishing the role of host tonight over to my coworker, James Morrison, who you see up on the screen. So James will be our host tonight. I'm going to monitor the chat function. I would encourage everybody to ask questions. What we're going to do, and one of the rules for tonight, is we're going to take a brief stop at the end of every presenter, and there's 4 tonight, and we'll try and take some questions. So I'll try and look at each of the questions and make sure we're not repeating ourselves, that sort of thing. And then, of course, at the end, we'll have an opportunity for the remainder of those questions. So please, we do encourage you to ask questions through tonight's program. So James, next slide, please.
Yeah, so just one last comment on this slide. Dean is probably one of the most personable CEOs. So if you have any questions about WholeHealth, about our banner, please feel free to reach out directly to Dean or to myself. We'd be happy to answer any questions. So don't hesitate.
Yeah, the last slide before I give it over to James. One of the things that happened around COVID-19, and we have a great number of people, and I just want to give a big welcome to everybody in Western Canada. Myself, I'm a University of Alberta graduate myself, and we have a tremendous amount of people from the province of Alberta on tonight, which is great to hear. COVID kind of slowed our progress as we spread our wings out into Western Canada. But just for everybody's knowledge, we may not be a household name yet in Western Canada, but we are I guess probably the newest banner, I guess, in the Canadian marketplace. And we do have plans to come out west. And so for the latter part of 2020, I almost can guarantee that you'll start hearing a lot more about WholeHealth. So with that, James, I'm going to hand it over to you so we can start talking a little bit about tonight's topic. So over to you. I will man that chat room and give you any questions I can get.
That's great, Dean. So we have 4 mini presentations lined up. We're going to try and take questions at the end of each speaker. So please feel free to enter your questions either in the Q&A box on Zoom. I'm also monitoring the Facebook Live feed, so you're welcome to type in questions there as well. We might be limited in terms of how many we can get to, but we can try and follow up with folks if we run out of time for the questions to be answered live. I just wanted to set the stage a little bit for the audience about what triggered me to bring together various tech innovators to present for us here tonight. And I've seen a lot of challenges throughout COVID as the practice environment dramatically changed overnight, really. And I'd just like to speak to a little bit about some of these changes. So the Canadian Pharmacists Association, back in May, they did surveys in May and April, and I'm going to speak to both of them. But in the May survey, pharmacists reported spending about a quarter of their days dealing with drug shortages. And they also reported at that time when they would, 46% of the time, they would order products, but then nothing would arrive in their order. So clearly drug shortages became even worse during COVID. And we do have a solution here that we're going to present tonight that gives pharmacists an opportunity to try and reach out to other pharmacists in their area in order to see if a neighbor has the product that they require for a patient. So stay tuned for that. In the April CPHA survey, they asked pharmacists about their biggest concerns during COVID. And one of those concerns was about the increase in workload and also staffing concerns. And there's a couple solutions we're going to present here tonight that can help with this issue, in particular with streamlining the prescription ordering process, but also empowering the pharmacy communication with prescribers directly. So yeah, so stay tuned. We have a couple different things that might actually help with this top concern.
James, just going to interrupt you for 1 second, just getting a little bit of comments about background noise. So just to make sure that everyone's muted.
Yeah, so I think the only person who might not be muted is Bhavesh. So I think he's muted now. Paul, let us know if it's gotten better for you, or Chris. Hopefully that's fine. Yeah, so in this CPHA survey, 60% of pharmacists also indicated that drug shortages was one of their top concerns, greatest concerns. So stay tuned for those presentations where we're going to present some solutions. In my role of operations, and I'm also a pharmacist, I've never seen scope or practice changes and roles and responsibilities for pharmacy professionals shift so dramatically over such a short period of time. And in that April survey, pharmacists identified that their prescription delivery volume had doubled. So it was a big demand on their resources in order to step up their delivery. And we do have a tech solution we're presenting here tonight that can help address that concern. Also, we've seen virtual care models rolled out for pharmacy that previously was not part of our scope or our ability to provide care virtually. And we have a really elegant solution that we're going to share with you tonight. I gave a little bit of feedback for this solution and they're ready to go live. So I'm really excited about that. The opportunities that might exist in the future to have medication reviews or device training, or even perhaps minor ailment assessment done virtually. We need to start thinking about these options and being early adopters. The last landscape change I wanted to mention was when we had prescribers become working in isolation, it became very difficult for us to reach them or communicate with them. And then the fax system maybe wasn't available anymore because they were away from their practices. Then we saw policies coming out to email prescriptions to pharmacies. Well, we have a solution called PrescribeIT that allows prescribers to communicate directly through their software into your dispensing software. So really good opportunities there to think about rolling out some of these options into the pharmacy. I'm also thinking forward about what does the future bring for pharmacy now that COVID is here to stay, at least for a while. So thinking about clinical services, what will flu season look like for pharmacies? Michael is going to speak to something he's working on to make streamlining flu vaccine process at the pharmacy a possibility. So listen carefully for Michael's take on that. And last thing I want to say is, throughout COVID, I'm very proud of my peers. I think pharmacists have really stepped up, and it's created this heightened role in the community as pharmacists being essential to the healthcare system, while other providers were closed their offices and were not available. Pharmacists really stepped up and filled the gap in care. So we need to hold on to that role that we've established and keep moving forward. So with that, Dean, I'm going to ask you to introduce Michael as he comes on the camera.
Yes, thanks, James. I understand I'm getting a little bit of static on my mic, so just bear with me for a minute, but I'll just take a second to introduce our first speaker, Michael Doe. And Michael is a pharmacist and the founder of MedEssist. Michael has over 10 years of pharmacy experience, including serving as a pharmacy manager of an independent community pharmacy in Toronto. Michael's also very passionate about teaching students and was awarded the 2018 Preceptor of the Year from the University of Toronto. So congratulations to you, Michael. I didn't know that. MedEssist itself is a University of Toronto-backed technology company creating unique solutions that are not only clinically sound for the patient, but are also designed to seamlessly fit into any pharmacy's workflow. MedEssist's mission is to improve the health of patients by empowering them with modern healthcare tools and enable a therapeutic relationship between patients and their local pharmacists. So, Michael, we welcome you tonight. Thanks for joining us, and the floor is yours.
Thank you so much, Dean and James and everyone else at the WholeHealth team for organizing this and for including us in. It's really amazing to be working with, a banner group that's so forward thinking, that's looking at technologies and looking at really, any opportunity to make the pharmacy environment better and to keep pharmacy sustainable. So really appreciate this whole event. And the companies here too I think they're very pharmacy focused. So that's amazing to see because they're not just looking at pharmacies as a revenue source, but they generally should be, they care about our environment and they care about pharmacy as a profession. And at MedEssist, I myself, I've been practicing for a long time, but our lead engineer is also a pharmacist with over 5 years of experience as well. So we build these solutions with the perspective that technology shouldn't just make the patient experience more convenient, but also it should be improving the pharmacist workflow as well, the pharmacist experience. Let's see if we can, I think I'm back here. So we have a couple of solutions that we want to share with you today. First, it's MedEssist Inventory, which is designed to help pharmacies handle drug shortages and really share inventory. And it's a completely free platform. It's free for any patient, any pharmacy across the nation. If you're from Quebec, you will have to message us and we'll add you in. But every other province is on the platform already. And just because it's free doesn't mean it's cheap. It's highly responsive because it's built off the same platform as our app service. So you can type in the DIN, type in the drug, and you're getting results pretty instantaneously. There's also a discount column where you can search for items at a discount. And when you click on an entry, you get to see all the other listings that pharmacy has. So you could potentially pick up a few things at the same time and be very efficient in that way. We also have a lot of little design things that we put in here, such as generating invoices for people. So, and we're looking for other ideas. If you have suggestions, please consider trying out the service and letting us know. So inventory, again, is completely free. It's there to help with drug shortages, there to help you find inventory at a discount. So you can pick up, just the right amount of rifampin that you need, for example, or, to sell off stock that you no longer need. So we do have a lot of signups. This is a new service, but we don't have as many postings as we want. I know pharmacies are busy, and I've been busy too, but I would really appreciate it if you guys tried it out and maybe made a post or two and really helped us build this community, which I think we can really build and really work towards.
Yeah, so Michael, in that system, you have the option to request a particular medication that you're looking for?
Absolutely. I forgot to mention that was a requested feature as well. So we put that in there. You can request items. You can set how long you want that request to show for the posting to be up. And again, it's going to get better and better as people use it and people come up with more ideas and how to make it even better. So I look forward to continuing that. And then we have the MedEssist app, which is there to help patients refill medications. And it's really remarkably easy to use because all patients have to do is scan their prescription receipt, and they're connected to the pharmacy and connected to healthcare information and images and videos about their particular medication. So it's really a healthcare tool as well as a pharmacy service. And we think that's incredibly important because COVID-19 has really changed healthcare. And we're no longer the most accessible healthcare professional if you can just webcam a doctor and have it paid by OHIP or your provincial body. So, and of course, there's online pharmacies that can send medications to your door. So we really have to be mindful of our perception through the public. And we think that being healthcare focused is the key. And having a digital storefront, a digital platform that is healthcare focused is vital. And are we prepared for Amazon when they come and they don't play by the rules? If they start to waive, the $100 senior deductible, waive 611, waive all the different fees, we have to have an answer for that and be prepared for that. And basically, there's Costco as well in the US. They're doing 1 hour delivery. And so we really need a solution that fits into what our vision of pharmacy is. And that's what we try to do with MedEssist. So it's not just a refill tool, it's generating mess checks and professional services. There's educational videos. We have 7 different languages, and it's really a healthcare tool for patients. The other thing with technology is, in a lot of ways, technology is a great equalizer. So for $1 a day, your independent pharmacy can have really the best healthcare and pharmacy app on the market, we think. And, you can provide that same experience that a larger company, a larger corporation like Amazon would provide. And our system is remarkably easy to use. It works with any pharmacy system. We set you up in 5 minutes through TeamViewer, and we have posters and handouts so we can send to you. And pharmacists love the fact that orders can print off automatically. So you don't need to look at a to-do list. You don't need to learn a new dashboard. Everything is automated, so you can have relief in, you can have new staff in, and everything will just continue to work seamlessly. Now, as James alluded to earlier, we are in the midst of developing this new solution for flu shots. So the thing is, in Australia right now, it's flu season, and they have long waiting lists of hundreds of patients because there's increased demand and reduced supply. So it's a huge problem, and this is going to be front page news all across Canada, all across North America in a few months. And my kind of question is, why do we have to just continue on as usual? I mean, there's things we can do, and if we don't do anything, I mean, pharmacies are just going to be put front and center regardless. So we designed this solution, which is available to pre-register right now. So if you go into inventory, there's a tab. If you pre-register, you can provide us with feedback as we develop the product, and you can get 20% off as well when the solution is live. And we know how difficult it is right now in terms of funding for flu shots because we have PPE to worry about. We have to physically distance patients. So we will keep costs as low as possible. We're looking at $1 or $2 a day. So that's what we're working hard to do. But let me explain a little bit about how it works. So the whole system is designed to really streamline the entire vaccination system, from registration to administration to documentation. Patients can register on the website, through the app, through a phone call, or at the pharmacy. So what what I will be doing with this platform is we're actually going to be calling up patients that got the flu shot from us last year. And we're going to tell them, we're doing flu shots differently this year. It's by appointment only to keep everyone safe. Would you like us to reserve you a dose? So this is a way for us to be proactive and make sure that we retain those patients, but at the same time, have it done in an organized way. You can also put a poster up, which we will provide at the front of your pharmacy. And as early as late August or September, all of September, you can have people that walk by the pharmacy and sign up for a flu shot early on. So you can get access to new customers and new patients that, by having this open early. And then when you get your doses in for that week, you put in how many doses you got that week. And you can also set things like interval, how often you want patients to come in, and communications with the patient. So you can put down that you want patients to come in with a mask. You want them to not come into the pharmacy if they have symptoms. So there's all this other things that we do to help that communication along. And then on the actual day of the administration, you get a list of patients, and you can download people's documentation forms. So before they come in, if they've registered through the website or by email, they can fill out all the documentation, so you don't have to worry about any of that. And that's just not only convenient for pharmacies, but also just there to help reduce the amount of contact that patients are exposed to. If you're interested, please register, and please be involved and give us feedback, because that's really how we get better at this. If we work on it together, the way we build good solutions is when we have feedback. So please, consider working with us, and that's about it. Thank you so much.
So Michael, with your flu technology you're developing there, when the patient are we downloading the completed assessment form already? Like, has the patient already gone through it?
Yes. So there's, and again, we haven't completely finalized all aspects of our process, but we already do this with our MedCheck or with MedChecks through our app. So it puts all the information into the actual PDF file. So we're going to be doing that, and we do this with the invoice as well on our web platform for invoices for sharing medications. So, yep, we ask them ahead of time if they're willing to share and fill out that information sheet before they come in, and then you can just download and print that off, and it saves everyone a lot of time.
Okay, I've heard a lot of pharmacists talking about wanting to reserve quiet times for providing flu shots this fall. So can you block off like early morning and late evening, or like can you not have during peak time? Like, what's the functionality?
And lunchtime as well. I don't want people coming in during my lunchtime for flu shots. Absolutely. So we really feel like the reason why a lot of pharmacists are worried about adding more and more workload is because we relinquish so much control, and we have to take that back. So the way our system works is you have a weekly schedule. You can pick exactly when you do flu shots. If you have enough PPE this week, or you have overlap, you can assign those times, and really giving pharmacies full control is really essential, we think, in terms of doing these extra services.
All right. So there's a couple questions. Dean, I don't know if you want to read those out. Dean, we can't hear you.
Yep, I got you there. Question from Sandra Allward, Michael. When the patient reserves a dose, is it at a specified pharmacy and specified time?
Okay, yes. So they reserve a dose at a specific pharmacy, but the timing and the schedule doesn't happen until you've added doses into your platform. But the whole system is designed so that when patients register with you, they will come back to you because they know that there's a dose reserved. And that's really, really critical, we think. But the timing doesn't happen like weeks and months ahead of time. It happens when you know you have that dose. I hope that answers the question.
I've got a question from Facebook, Michael. So how do you aid pharmacies in getting uptake to the apps or website?
Absolutely. So there's a lot. So we give handouts and posters, but really it depends is basically my answer. So you have younger patients, their convenience might play a bigger role. So that's how, that's sometimes what you do. If you have older patients over 65, they're looking at it as a healthcare tool. And how you present it is very essential. So you can say, you know, we have a lot of patients using this, or it's very important for you to take your medications on time, or you need a way to make sure that, you know, you don't miss doses, for example. And then you get a mess check out of setting them up. But sometimes it's situational, where, you know, a patient's been waiting a while. You can give them something to do. Next time, if you like, you can send us a prescription ahead of time and we can have it all ready for you. So it's a way for you. There's different use cases, and you as a pharmacist kind of know your patients well, and you know really how to present it depending on who you have that relationship with.
Yeah, the only other question was, how do they contact MedEssist? So Michael's contact information is there on the slide. So info@medassist.ca. So not through WholeHealth, you can reach out to Michael directly. So thank you very much, Michael. That was really eye-opening. We're going to move on to the next speaker.
All right, thank you,
Can you
Dave.
introduce?
Our next speaker is Bhavesh Modi, and Bhavesh is the Director of Pharmacy Relations and Deployment for Canada Health Infoway. He earned his Master of Sciences in Pharmacy in 2013, and since then he has been working with several organizations on their pharmacy transformation journey by leveraging technologies and innovation to further advance the pharmacy profession. As a practicing pharmacist, Bhavesh has implemented key strategic health initiatives and patient education opportunities while growing the pharmacy business within expanded scope of practice. Currently, Bhavesh, his primary focus is at PrescribeIT. Everybody's been talking about this. I think a lot of people, Bhavesh, will be kind of curious about PrescribeIT. And I'm going to hand it over to you. I know tonight, too, I think I saw Doug Brown's name up on the participant list, and I know that Doug was an early adopter of PrescribeIT. So if there's any questions, you know, about Doug's experience, and I think Doug would probably be happy to answer those as well. So anyways, Bhavesh, over to you.
Thanks, Dean. I appreciate it. Good evening, everyone. Hopefully you can hear me okay. I'll let Dean take the heat for the background noise. I was on mute, so definitely appreciate the opportunity here, and I thank the WholeHealth team and all the attendees here. So I wanted to start off with a quick plug to WholeHealth to let them know we've been fortunate to work with them and several members of the WholeHealth group. As mentioned, you know, Doug Brown, we currently have more than about 50% of pharmacies within the banner that are either registered or live with PrescribeIT today. So great uptake and really shows the forward thinking with your membership group. To really tie into today's theme of technology and how pharmacists can navigate COVID-19 and beyond, I wanted to share a quick stat. It's a real eye-opener. In 2018, ISMP reported that Canada had only a 3% adoption rate of e-prescribing when compared to other developed countries. This is where other developed countries have seen adoption rates greater than 70, 80, 90%. So it really shows the importance of today's discussion, as many jurisdictions we've seen have allowed temporary measures to enable, you know, a form of e-prescribing when we do know there are safe and secure options like PrescribeIT available today. So wanted to set the stage to really talk about the current landscape, and as James and Dean have alluded to, there's an opportunity for us to impact a significant amount of change here. So moving to the next slide, I believe I've got control.
Maybe, is it good?
Yeah, it's a bit tricky.
Okay.
There you go. So for those who may be familiar with Canada Health Infoway, I'll provide a quick background just to let those who may not be familiar with us. We are an independent, not-for-profit organization that's federally funded through Health Canada. Infoway has evolved over time, and previously more of a strategic investor role to now a service provider role, focusing on two key areas of business, one being PrescribeIT and the other being Access 2022. So today we'll focus on PrescribeIT, where our primary purpose is to realize the vision of healthier Canadians through innovative digital solutions. So it sets the stage on what we're trying to achieve within the current landscape. To provide a bit of an overview and objective of PrescribeIT, we're really here to create and operate as a non-for-profit organization, but to create a financially self-sustained e-prescribing service. And that's key, because in the long term, we want to be the go-to-market solution of choice for electronic transmission of prescriptions in Canada, and to really bump up that number of 3% to something that's more noteworthy across the board. Although we recognize prescribers and pharmacists like yourselves can benefit most from the solution, the ultimate goal is to really benefit the patients and to improve patient safety. And we'll demonstrate that a bit more in some of the details in the service offering here. To really show where we are today, and if you've seen us lately in the media, we've had a lot of exposure recently during COVID, even before COVID, as we've made some significant progress and have reached a few key milestones over the last few years. The key note here is that we are a national service, and we are currently live in 5 jurisdictions. Those jurisdictions are Ontario, Alberta, New Brunswick, Saskatchewan, and Newfoundland. So it's a good representation of how PrescribeIT works across the country. We also have plans to expand in 2 additional provinces, hopefully this year, and that'll increase the representation across the board. Definitely great to have a large presence of folks from Ontario and Alberta, and I have heard a lot of folks coming from all provinces on the call today. So hopefully, it's coming to your province if it's not there. We have been able to work with our EMR and PMS partners, and that's allowed us to grow across the country where certain provinces may have specific systems in play. And the idea is that having an integrated e-prescribing solution has really been a key differentiator between PrescribeIT and potentially other products out there. So really intensifying that value proposition and making it the first choice and the only choice, especially during these times where we have seen an increasing need for virtual platforms. If a prescriber is not able to access the clinic or see patients, they need to have an offering that patients can still be seen and prescriptions can still be delivered to the pharmacy. So PrescribeIT offers a service that during this time has been called upon, and even with our current users, we've seen an increased number of transmissions because they're relying on the service a lot more, where handling paper or fax prescriptions is something in the past. And during this time where, viruses can live on surfaces, we're really looking at introducing this in many more practices. And as it's going to become the new norm, the dynamics are now shifting. So we've really made great progress, and we continue to do so during this time. The slide is a bit more technical, but really wanted to show you the overview of how the service works, since there are some endpoints that might cause confusion or maybe not clearly identified. So the PrescribeIT Central Hub, which is the area in middle, which is the scope of the PrescribeIT solution, that is where the facilitation between e-prescribing and clinical communications can occur. So the key message here is that PrescribeIT is not meant to replace other systems that are already being used. Instead, it's meant to augment the existing systems, EMR systems, for example, where they're already connected and able to run through the service. So there won't be necessarily a new addition of systems or platforms. It's really to connect with the systems that are already in place. So as an example, from the prescriber side, we've got on the left-hand side of the screen, prescribers using their EMRs today to service their patients and provide prescriptions. In a PrescribeIT world, we have the same type of setup, where in the new world, we have the prescribers logging in, for example, to their EMR, and then have a second factor authentication to leverage the PrescribeIT service. And that would allow them to generate a prescription as they normally would, and instead of selecting the option to print or fax the prescription, they'd be able to select e-prescribe. And that really is the minimal difference from the current practice today. And on the opposite side, or from the pharmacy side, PrescribeIT is integrated within the current pharmacy management systems today. So on a later slide, we'll show some of the vendors that we're working with, but really it's meant to be built into the existing framework so that nuances with workflow and the change management processes can be more intuitive. And again, it's an evolving product as well. So as we build on the foundational functionalities, it will evolve and iterate over time. So to really highlight some of those initial functionalities and the current scope of PrescribeIT, the initial release is really built into 5 major capabilities. To start, and the most simple form of e-prescribing is the capability for a prescriber to send a new prescription. Again, next, from the pharmacy side, the pharmacy can request an electronic prescription, through their pharmacy system, and the prescriber would be able to see that within their EMR and respond, in a shorter amount of time, and the prescription can be sent back to the pharmacy. So really showing that end-to-end transmission between the healthcare providers. There's additional functionality to showcase the actual status of a prescription. So whether the prescription has been dispensed, there's a passive dispense notification that's presented into a patient chart on the physician side or prescriber side, as well as the opportunity for a prescriber to cancel a prescription if they say sent it in error. And that's a missing piece in today's landscape, where a patient may receive a paper prescription and the prescriber may not know if it was dispensed, if the patient lost the prescription, really what the patient outcomes are after that point of prescribing. So really focusing on more visibility in that sense. And then the last 2 features are the second last feature is really specific to certain provinces, but it allows prescribers at the point of prescribing the ability to see relative cost of a molecule. So if, for example, a patient is price sensitive to a specific product, the prescriber may be able to see an alternative that might be more suitable for someone who's cost conscious. And in terms of the information that's displayed, it would be relative to the dollar signs of drug A versus the dollar signs for drug B. And that's been effective at reducing the amount of communication back and forth between prescriber and pharmacist if that was ever an issue. This last feature and functionality is really a game changer for us, and we're hoping it's also a game changer for you, as clinical communications have been a tool that has improved response times for patients to receive their medication clarifications, or even just renewal responses are coming back from prescribers in shorter time frames versus the current paper and fax form, where the fax is sitting on the office desk for a day or 2, and then the pharmacy may send another one. The communications tool will allow safe and secure messaging and really reduce the resource consuming nature of phone and fax communications with prescribers. So the 5 features here are really the core functionality that PrescribeIT has built on, and really sets the foundation of where PrescribeIT is putting a lot of efforts on in today's market. With that, recognizing that as the service evolves, additional features, as you can see on screen, will help to support pharmacy practices and prescriber practices to really be more collaborative and understand the needs of prescribers and pharmacists in that relationship, with the benefit at the end of the day being for the patient. So one call out on this slide here from a functionality standpoint is the support for non-physician prescriber roles. We've been seeing most recently and successfully implementing PrescribeIT with several nurse practitioners. And that's a key area for most family health teams, where several of the nurse practitioners are high volume prescribers and they have a good handle on how their EMR works. It's a good opportunity for them to be a champion and allow the prescribers in the office as well to see the benefits of using PrescribeIT and showcasing the e-prescribing service as a whole. The last few pieces of information are really to get into the PrescribeIT difference and the value proposition. And to illustrate some of these, I've highlighted some of the key differences, as we're all familiar with the current paper and fax workflows. The ideal and in moving forward with technology, the benefits of PrescribeIT really are 4 or 5-fold, where pharmacists are able to process refill requests a lot quicker, new prescriptions can come in a lot faster, and then pharmacies are able to be a bit more efficient with their data transcription, as some of the data can be pre-populated depending on the pharmacy system. So the ability to have some data pre-populated that's already provided in a prescription is a big plus. As mentioned, the ability to easily communicate with healthcare providers. The current methods of fax phone, as mentioned, are really outdated, and really trying to showcase that this feature is a game changer, and it really helps to build that relationship. This is a major capability where the current technology is unreliable, not safe, not secure. So we'd like to call out that these are major differences within the PrescribeIT framework. And then finally, we know that medication adherence is a large issue. So to have the ability to have greater visibility as well with patients' prescriptions when they're dispensing them, and if there's an ability to have insight when a patient is in a clinic the next time, that prescriber and patient may have a more fruitful conversation. And at the end of the day, the pharmacy should be able to see the benefits of that while the patient has increased medication adherence. So really, what's the value for pharmacists, right? We want to talk about the value proposition. We know that patient safety is of utmost importance. There is a potential for an increased first fill compliance. We have seen some preliminary data that pharmacies are seeing that there's a natural lift in prescription volume. Again, being able to capture that prescription, efficiently process it through your systems, and be able to communicate to prescribers if there are any clarifications. That whole process and workflow can be managed a lot smoother than the current process. So there are benefits that can be easily seen and very tangible, with the fact that there's really no upfront capital investment. This is a service that's been subsidized by Health Canada. The funding has been covering upfront costs and currently the cost of the service today. The idea is that the value proposition and the real benefit for pharmacists and patients at the end of the day will outweigh the nominal transaction fee, that the future fee that is to be determined. Really goes into the next piece with the financial operating model. So today, Infoway's philosophy is really to keep the cost down by capitalizing on economies of scale. This is really a volume play, where the more prescriptions that go through the service, the cost would go down. As a non-for-profit organization, that's the key pillar. So currently there's no fee for pharmacies today, and that will continue until further notice and after extensive stakeholder communication. It's really key that we call out that the transaction fee would only be applied to a new or renewed prescription. There would be no fee for a refill of a prescription, and any other features like the clinical communications, the added benefits of seeing, cost of a prescription, those would not be considered transaction or prescription associated transactions. Those are really value added to the service. So a real great way to augment your current practice with the ability to try the service out, see how the service works for your practice, and then to build that network and ecosystem with your clinics nearby, your prescribers, and then ultimately your patients. There are some economic or ROI tools available to help individual pharmacies to quantify benefits specifically for your pharmacy. So we can definitely work with individual pharmacy owners at that point if necessary. And then finally, we wanted to showcase, where we are on our journey and who we've been working with, and it really shows that clinicians need a service like this, and the technology partners are listening. They recognize the value of integrating PrescribeIT within their systems, whether that be on the pharmacy side or within the clinic practice setting and on the EMR. So we are gaining traction with both groups, and you can see on the slide that for most pharmacy systems, we have had traction with all vendors, if not majority of them, and we continue to grow on the EMR side. So how do you get registered and how do you learn more? So the link to get started with PrescribeIT is on the screen. I know James will be providing some links to some conversations that we've had with clinicians. I believe there's an interview with Doug Brown. You can definitely reach out to your peers and to myself to provide more information, and we're looking forward to working with the group as we've enjoyed this success so far and continue with the momentum.
So Dean, did you want to come on and do the questions?
Yeah, James, we just have we have a couple outstanding.
The first one is really just provincial, Bhavesh. It's about Manitoba and BC and status in both of those provinces.
For sure. Yeah, thanks for the question, and definitely making progress at the jurisdictional level. I'd say that both provinces are on our roadmap for this year to have those conversations, keeping in mind that there are market dynamics specifically with both of those provinces that it might preclude us from moving forward as fast as we'd like. But I'd say that the account management team is heavily invested on bringing on those two additional provinces, and we can discuss the specifics. If there's a province in specific, we can take that back and provide you more information.
Yeah, and Bhavesh, there's one more about, and again, it's provincially focused. It's any plans for interconnectivity to future provincial systems like ConnectCare in Alberta.
It's a great question. I think we definitely have the mindset to leverage existing, provincial assets. I know for the most part there are, parallel conversations to enable pharmacies and provinces with PrescribeIT, as well as connect to their DIS or their drug information system. So at a first glance, that's definitely something that's achievable on the drug information side. We want to look at individual platforms that offer some sort of connectivity to see if there's opportunities. On the outset, the idea is to connect community pharmacies with community prescribers. So as the program evolves, we've seen an interest with platforms, as you mentioned. We've seen interest on the hospital side, specialty. There's a large group of technology vendors who are looking to integrate, and one of the key pieces on the PrescribeIT side is that it's got to go through the process, and knowing that all of these vendors are looking to integrate, we have teams to address them. So I think that's a positive.
So Bhavesh, I have a question from myself. I'm very familiar with PrescribeIT, and I certainly see the benefits. I'm just wondering, are there any barriers that are stopping folks from signing up other than you don't offer it in their area? Like, what is stopping people from joining and participating?
There's no barrier to register. It gives us visibility to those who are interested. In terms of overall barriers, I would maybe say that we like to work with pharmacies in the community that you're in. So it's a tandem approach where we want to have a prescriber who's using the service as well, so the pharmacy can see the value and actually interact with the service. If a pharmacy is enabled with the service, they may not receive a prescription for some time potentially, or they would need to identify prescribers outside of their geographic area. So the opportunity is endless. They can still kick the tires. They can understand how the solution works. We're of the mindset that, if pharmacies are enabled, then prescribers have less of a reason to, not want to proceed, given that the pharmacies are ready to go. And we've seen that pharmacies are a bit more, they can take on the technology a bit more faster and effectively than some of their colleagues on the EMR side.
All right, very interesting. I'm a big fan of PrescribeIT, and I'm grateful that you took your time out tonight, Bhavesh, to join us and share a little bit about it with our pharmacist audience. So thank you very much. I'll get you to switch off, and we'll go to our next speaker.
Thanks, James. Thanks, Dean. Thanks, everyone.
Have a great night, Bhavesh.
You too.
All right, our next speaker, I mean, definitely the rose between a whole bunch of thorns tonight. Risu is the co-founder and chief medical officer at MedMe Health. And that's a patient care platform designed by pharmacists, for pharmacists to schedule, track, and conduct clinical services virtually and at scale. When Ree was in WholeHealth's office, this had a huge cool factor. So I'm very happy that she's on the panel tonight. Ree holds a PharmD from the University of Waterloo and previously co-authored 3 nationally accredited pharmacy programs and worked across oncology, geriatrics, and mental health. So Ree, welcome, and the floor is yours.
Ree, you're on mute.
Perfect. I needed to unmute myself. If you wouldn't mind giving me back remote control.
I swear, folks, she's a tech genius.
Hi, everyone. Thank you so much, Dean and James, as well as the rest of the WholeHealth team for having us here today. James had mentioned that he had given us some early feedback on our product, which was quite instrumental in being able to, fundamentally design a clinical care platform that's built for the pharmacist use case. And back when, we first presented MedMe to Dean at WholeHealth, there was just the synergy in terms of our overall vision in pushing pharmacy forward into the digital landscape, but also enabling our transformation from a product-focused business to a service-focused one. And it's really my pleasure to be here and also to be speaking to all these pharmacists across Canada about how we hope to do that here at MedMe. And I just need, James, you to give back control of your screen to me.
Yeah, for folks watching, we're juggling the remote control with several people through this presentation, so we appreciate your patience.
Perfect. And there we go. Perfect. So what I really wanted to talk about today is that this proliferation of virtual care that we have all seen over the last few months. And it has been primarily been within telemedicine and physicians conducting consultations with their patients. And there was a recent CMA poll that showed a 91% satisfaction score of patients with virtual visits. And so now when patients are extremely excited about the accessibility of virtual care, we are kind of find ourselves as a chasm when we look at pharmacy, which is not really uptaking or utilizing virtual care as much as physicians. And with permanent billing codes that are coming out, we really need to think about how do we position pharmacy in this increasingly digitized world. And I think for us, the switch isn't as easy. And that's because of our traditional workflow. And so when we look at pharmacy, we're not the same as a physician's clinical practice, because virtual care is not as simple as replacing an in-person visit with a video call for us. The call itself is just one step out of many for us to be able to deliver a clinical service, even schedule it, document it adequately, to have it fundamentally be reimbursed by payers like the government. And so when we look at the current state of affairs and where we are now during a global pandemic, when patients aren't coming to the pharmacy, or maybe even in the future when patients find the accessibility of an internet pharmacy or other virtual modes of doing things to be more accessible, how do we as pharmacists continue to engage patients, provide our clinical services, and enable continuity of care in this increasingly digitized landscape? And so when here at MedMe Health, we have talked to hundreds of pharmacists, especially in the last couple of months, and we see early users trying to piece together a number of ad hoc solutions to tackle this problem. And so these solutions may be actually starting to use the Google Calendar, or maybe using other video conferencing solutions like Zoom, which we're using right now, to be able to reach their patients. But the problem with these solutions is that they are often not secure, often not HIPAA or HIPAA compliant, and they're only a piece of the puzzle. Because when we look at their overall workflow of a pharmacist, there's also other pieces like the often tedious documentation that we have to fill out, often manually, and then scan, and then fax. Also, being able to have access to our patient information. So if these software don't have integration with our existing systems, how do we do our clinical services at scale? And then lastly is the tracking down of patients. So when previously patients are coming into the pharmacy, you could schedule them in for a medication review right then and there. You could follow up with them right then and there. But in this digitized world, how do we do that? And how do we do that in a scalable manner? And the last piece I want to mention here is that when you are juggling multiple of these different software, and we have had users switch to MedMe from maybe 4 or 5 different softwares that you're using, it's too much, it's not integrated, it's not going to make your life easier. And so we thought, wouldn't it be ideal if we could have all of these pieces centralized on one platform where you're able to automatically engage and schedule with your patients, conduct the secure video consultation while being able to complete all the documentation that's required, whether it's per jurisdiction requirements or clinical notes that you want to capture. And lastly, being able to schedule automated follow-ups and monitoring, which notoriously is one of the things that we don't do as often with the patient to ensure that continuity of care. And so that's what we did. And that's fundamentally what MedMe facilitates. So we are a web-based patient care platform to allow pharmacists to provide their clinical services at scale. And we do this through 4 very simple steps. And the first step is the scheduling step. So when we think about clinical services that can be conducted in a pharmacy, there's the on-site clinical services like injections and immunizations. And then there's also services that can be either conducted virtually or on-site as well. And it's stuff like a counseling appointment, a medication review, or maybe even out-of-pocket appointments such as like an ideal protein appointment, a travel medicine appointment, cannabis counseling appointment. So all of these appointments can be scheduled directly onto the pharmacy's calendar, and it could be scheduled either from the pharmacist or the patient themselves. So on our platform, the pharmacist can choose to add an appointment, choose a type, duration, and mode, whether it's on-site or virtual, and be able to confirm the appointment right away with the patient. Otherwise, the pharmacist can send a scheduling link directly to the patient where they can choose which clinical service they want, or the specific clinical service the pharmacist wants to conduct, and then choose their time and fill out a series of other onboarding information. And that leads me to my second slide here, where it's really, really simple for the patient to actually onboard. So we found that one of the biggest challenges is when a patient has to download an app. There's just too many barriers for them to access their care, especially when we look at older patients, older adults who have multiple chronic diseases. To them, it's not a natural thing to juggle and download multiple applications. So what we've designed here at MedMe is that everything is link-based and sent to the patient via SMS, text, and email, which means that they're communicating with our platform and onboarding onto our platform the same way they're communicating with their friends and family. And so what it looks like when an appointment is scheduled is that if the pharmacist clicks, okay, let's have the patient schedule an appointment. A link is then sent to the patient on their device, whether it's on their laptop, whether it's on their phone, and we support all mobile and laptop devices currently, including the iPad as well. And they're able to click on the link to enter their specific onboarding intake. So similar to the physical intake form that you may have, we can customize each intake form depending on the clinical service. Say if you're doing a travel medicine consult and you want more detailed collection of their immunization history, we can collect that. If you're just doing a medication review and you want their basic information for them to just confirm some of the existing information we already have from the pharmacy management system, that's the simple intake you have. There's also two key features that we enable here, which is the ability to send secure images just through this web-based link. And so if patients have a number of different natural health products, OTCs, or anything they want to look at, maybe a hospital discharge summary, they can easily upload a picture of it, take a picture of it right away, and have it in the MedMe platform for you to review before the consultation. The second piece here is that informed consent. And per each province's legislation, we have customized the informed consent for the video consultation and facilitate the e-signature, which per Canadian regulations is an acceptable signature for their consent. And so we have customized consent forms for each province that we service. And point two is the video consultation itself. We've made it really, really simple for the patient to onboard. So when the pharmacist is ready for their call on the MedMe platform, all they have to do is click the Start Call button, and a link is automatically sent to the patient to join the call. So whether it's on their phone, whether it's on their laptop, the patient can just click on it and be able to enter the virtual room right away. And we're also able to track whether the consult was actually completed, whether it was deferred, whether there was a no-show, and these are all analytics for the pharmacy that we're able to track to see how well you're doing or where points of improvements are. The other part is that we're actually able to track the whole entire time of the consultation. So we're able to see for auditing purposes how much time the pharmacist spent with the patient during the consultation. And the third piece here is the documentation, which historically has been the most tedious and manual for pharmacists to do. So what we enable here at MedMe is that we enable a completely paperless workflow that allows for the documentation to be directly done on our platform during the consultation itself. And then afterwards, a PDF version is automatically generated that can then be built into your pharmacy management system. And so whether it's documentation, whether it's like simple documentation for a consultation or a more standardized documentation that's required per the province, we're able to facilitate all of that. And as you can see here, we have the Ontario MedCheck documentation, which is notorious for being like over 20 pages long and very manual and tedious to fill out. But we also support other documentation like the SNAP documentation in Saskatchewan. And as we grow across provinces, we're also supporting more of those legislated required documents as well. And just the last piece here, I think, is something that, like I mentioned earlier, is just not done enough in pharmacy, but so very vital to the patient and their continuity of care. And so right now, because of how busy we are in our everyday workflow, is just too manual and too tedious to remember to follow up with a patient in like 3 days or 4 days. Maybe it's a note in a basket, maybe it's a more organized agenda that you have for yourself, but we're trying to take this off your hands. So what we enable is pharmacists to schedule automated follow-ups at the click of a button. So whether it's choosing to book a 15-minute call 2 weeks or a month after your medication review or your counseling, or scheduling an automated text message to be sent to the patient a few days after they started a new medication. We think about the clinical use cases of pharmacists and the importance of follow-ups and enable that all to be delivered in a more automated fashion as well. let me just go back here. In terms of other features, I'm really excited to tell you about that are live right now. The first one is that we do integrate with existing pharmacy management systems. And so we're able to auto-populate, whether it's all your patients or a group of your patients, onto MedMe and grab their personal health information, including their medications, the directions to their medications, their medical conditions, their allergies, their contact information, all of this, so there's no need for double entry on our platform. The second piece is we allow remote access to data. So this is very new and completely HIPAA and PIPEDA compliant in terms of how we do it, but we enable pharmacists to practice from home. Because our platform is a web-based platform, pharmacists can access it using their unique logins from anywhere. And this just opens up possibilities for the delivery of clinical services, whether it's being able to staff someone with a certified geriatric specialization who lives maybe like a couple 100 miles away, or just being able to manage the scheduling of your clinical appointments so that it's not always when the pharmacy is open. And in terms of our growth and our traction, we were actually featured by the Ontario Pharmacists Association in their virtual care guide as the only pharmacy-specific virtual care platform that is fully compliant with regulations. And MedMe is currently being used in pharmacies in Ontario and Alberta, and we're quickly expanding to pharmacies in Saskatchewan and Nova Scotia as well. I saw a comment about BC. That's also something that we're growing into in the future. And fundamentally, our goal is to support pharmacists all across Canada to be able to implement virtual care into their practice, and not just virtual care in substituting a phone call or in-person visit with a video call, but to actually be able to use all of the digitized technologies to deliver care in a virtualized way, to deliver clinical services in this newly digitized world in a patient-centered way and in a structured way as well. And thank you so much for all of your time. If you're interested in learning more about what we do, you can email me directly. If we'll just go back there, you can email me directly at ria@medmehelp.com, or you can schedule a demo right here, calendly.com/risu. So thank you so much for your time. Thanks again, James.
Thank you, Bree. I think Dean's going to come on and ask you the questions.
Bree, yeah, I'll let you take a drink of water there, and then there's about 3 here. Question 1, have privacy impact assessments been completed by pharmacies using MedMe in each province?
Yes, so we have our own privacy impact statement, and we conduct a PIA with each pharmacy that we onboard depending on the province. So like I said, right now we are live in Ontario and Alberta, and so we've conducted PIAs with our clients there. And then as we move into Saskatchewan, Nova Scotia, and other provinces, we will be conducting full PIAs in collaboration with the pharmacies that we onboard with as well.
Okay, thank you for that. Where is it here? Can you expand further on the levels of security built into this system? Is it better than Zoom and others?
So Zoom by itself is not HIPAA compliant, HIPAA compliant being the most stringent level of compliancy. When we look at the Canadian regulations, we have PIPA and PIPEDA, and only Zoom for healthcare is accredited under those regulations. In terms of our architecture, we are fully HIPAA compliant, so on a more stringent level of compliancy, and our backend architecture is built using the same servers and infrastructure as I believe the CPHA, the Can Immunize app, Kingston Hospital, etc. I'm happy to send over a more detailed description. We have some very detailed technical documents, but like I mentioned before, we also have a privacy impact statement as well, describing all of our incident mitigation strategies and our privacy strategy. And if you are interested, you can also go on our website. We also have a special privacy section that tells you who our partners are, and that will go into more detail as well.
And last one here before we move on to the next speaker is, can we easily utilize different parts of the service without using all of it with each patient? For example, using the schedule without needing the patient to fill out the intake form, or using the virtual documentation forms without having a virtual consultation.
Absolutely. So our platform was designed for a comprehensive clinical service use in both for on-site clinical services and virtual clinical services. And so if you just wanted to use it to schedule an appointment and you just wanted to have a simple 15-minute consultation, you don't want an intake, we have a directly call now and book now link. Or if you don't want to use the specific documentation forms, we can enable that as well. It's a fully functioning multifunctional platform that allows you to use it customizably in different clinical services. But if you just have a very, I guess, more simple practice, you're able to use it as well. Now, I just got word from my privacy officer, who's also watching this, that our platform is fully compliant with servers all in Canada. All our data is fully encrypted at rest and in transit with AES-256 encryption. I'm not a technological person, but our privacy officer has provided that information.
That's great.
Whatever that means, that sounds like the right answer.
Very impressive. So yeah, what I like about MedMe is the simplicity of the interface. Like, it's just enough that it's not overwhelming, and its ease of use is going to be exceptional. So I'd encourage pharmacy professionals, now that we have this opportunity to embrace virtual care, this is the time to step up and look at your business and how can you use this with your patients, and make them love the experience so that it's not something that will go away in the future. So thank you again, Ree. We're going to move on to our next speaker. That was excellent.
Thanks, Ree. All right, thanks, James. Our last speaker, last but not least, is Spencer Turbot, and it's an organization we know pretty well at WholeHealth. Spencer is one of the 3 co-founders of iApotheca Healthcare, a software company that designs tools to help improve pharmacy workflows and operations through the use of technology. Tonight, iApotheca is going to talk to you about a recently launched program called Econoroute delivery software. And I thought this was pretty interesting, especially with COVID and the fact that the numbers of deliveries in pharmacies have skyrocketed over the last few months. So with that, Spencer, I'm going to throw it over to you, and the floor is yours, and welcome.
Awesome. Well, thank you very much, Dean, and thank you, James, as well, for having me. Also, thank you to the other panelists for coming on board. I've learned some new stuff today already. Some of you I've already met in the past, but it's great to hear more about what you're doing and what you're offering. I've always enjoyed the initiatives that WholeHealth works on. One that stays in my mind is the virtual flu shots that were done, I believe, last year. I really loved what you guys are doing with some of these initiatives. So I look forward to seeing what you do in the future, and hope we can continue to work together. So thanks for having me on the webinar, guys. I'm going to hop right in if I can access the slides here. All right. James here, how do we toggle back to the full screen?
Yeah, maybe. So I'm going to seal the mouse.
There you go.
Now you try.
Okay.
All right.
There we go. Awesome. Thank you very much. So, first today, I want to start by telling all of you about why you should be offering a pharmacy delivery service in 2020. Now, most of you likely already do offer a pharmacy delivery service in some sort, or whether it be a small number of deliveries per week or a large number of deliveries per week. But there's a lot that goes into it, not just technology. So I'm going to start by talking a little bit about that. As mentioned earlier at the start of the webinar, according to the Canadian Pharmacists Association, deliveries since COVID began have doubled. And this is something that I was very surprised with, that it was that significant this quickly. But there's many reasons, not just COVID, to be focusing on your delivery operations and improving them. So deliveries was on the rise across many different industries before COVID. 80% of Canadians who now shop online, out of 80%, 67% shop more often at stores that offer a delivery service that they're happy with. And we've already seen this in the grocery industry. According to BDC, Canada is predicted to grow at a cumulative annual growth rate of 21% by 2024. And this was a prediction that was made before the pandemic. So we're also seeing similar increases in other industries, like with food delivery sales. So now is definitely the time to start offering delivery. If you look at some of the larger chains, Shoppers Drug Mart launched same-day delivery back in June of 2019. Rexall delivers right across Canada to patients in their homes, and London Drugs out west offers same-day delivery. So no matter where you go, whether it's a chain or an independent pharmacy, there's lots of competition that delivers. Now, I want to talk a bit about how delivery services can increase your revenue. The first one is the ability to attract new patients. So many times the majority of your patient base is going to be local to your neighborhood or your specific area, and delivery gives you a chance to expand upon that and go much wider in order to market your clinical services to all sorts of different people. Another method to increase your revenue is by retaining current customers. You know, delivery is so important right now with social distancing, and it really can help show that you're providing value and keeping loyal to those customers who have been coming to you before COVID. Now, this next one might be a little bit controversial because I'm talking about increasing front shop sales, and most of you have probably experienced a large decline in front shop sales right now, with less and less people coming into the pharmacy, staying in their homes. So there is an opportunity here to get your front shop sales back up, and you can do it in a few different ways. The first one is look at all the different chances that your staff have, as well as your delivery driver who are delivering medications, to interact with patients, and take your 3 to 5 most often sold front shop items and suggest them. Explain that you can actually offer these items and have them delivered alongside their medication that you're already delivering to them, often free of charge. So this is one great thing you can do. And another thing you can do is you can get postcard size advertisements created that you staple onto the package that you're delivering that have some images of the front shop items that you are offering and able to deliver. And these postcards are cheap. You can go on Vistaprint or Printing Frog and buy 1,000 of them for like 65 bucks. Very cheap to do. So lastly, it gives you the chance to have a new perspective in terms of how you service your patients and what you do virtually versus in person. So what will service look like for delivery? This is for those of which who haven't offered delivery yet, as well as those of which who are looking to ramp up their delivery operation. There are a lot of questions to ask, and I know that it can be overwhelming, whether you outsource or do in-house delivery, how long patients are gonna have to wait, are there fees involved, what software technology are you using, is there legislation or insurance? These are things that we recognize can be quite overwhelming, but because we've worked at iApotheca with over 1,000 pharmacies right across every province, we've been able to help pharmacies not only with the technology piece, but also with other ways to improve their delivery service or answer some of these questions that may be causing them confusion or stress. So there are a number of different advantages and disadvantages of outsourcing your deliveries versus doing them in-house. As your operation grows, it can be really, really beneficial to bring those in-house. And as you can see, some of them here on the slide today. So if you want to talk about these advantages and disadvantages off the webinar, I'm happy, and my team is to speak more about that. So this brings me to Econoroute. What we've done is we've developed an easy software module that is web-based, where you can create your different delivery runs, 7 days a week, whenever you'd like to deliver, and you can add patient orders to these delivery runs. Then you can click our Econoroute button, and it will optimize the absolute best route for all of your deliveries to be completed in order to save you time and fuel. So that's how the Econoroute feature itself works. Now, there's also a whole bunch of audit trail and reporting to make sure that you're in compliance with the college's regulations. You can track every single delivery within the pharmacy and where they're at. And we have recently added pay at the door integration with Square. This is just being released this week. So we're actually offering payment integration so you can collect payments at the door, which I'll explain a bit more about in a moment. So as I mentioned, the Econoroute feature helps optimize your delivery route. So it may be a little hard to see on the slide here, but on the left, we've got about 20 different deliveries or 18 deliveries plotted on a map. And once you've added a patient once, you never have to add them to our platform again. It saves their address and all of their information, and then you can optimize a route for your delivery driver. Now, you'll see some of these little pins on the left are green and some are yellow. Green signifies that there's a successful delivery that's been made. Any attempts are going to show up as orange, and any undeliverable items are going to show up as red. So you can track what's going on with your driver as they use their smartphone to record deliveries while they're out there on the road. Now, in order for the delivery drivers to access this, they can use any smartphone, and they don't even need to download an app. It's completely mobile friendly, and they're able to only see what's necessary, which is each delivery order in order with any notes that the pharmacy has provided them, and they can capture deliveries in a few different ways and record successful deliveries or attempts. So I talked a little bit about the audit trail and reporting. You're able to see a history of every delivery or attempt, when it was made. You can capture signatures, electronic signatures. We don't have that in right now because of COVID, but it will be brought back in once the college deems it appropriate to do so. And in the meantime, you can record different ways of a successful delivery being made. For example, leaving it in the mailbox, on a front door, confirming that the patient has received it visually or by phone call. There's all different sorts of methods you can use to, at your own judgment, to make sure that these things are recorded. Now, we're just launching our pay at the door integration with Square. Square's got these little devices that work through Bluetooth with a smartphone, where the patient can tap their card or insert their chip or even swipe in order to make a payment at the door. The hardware is very inexpensive. It's $59 to get the device, and you only pay that fee once. There is a flat fee that Square charges for the transactions of 2.65%, regardless of what type of credit card is being used. There are no additional transaction fees, and we do know that 2.65%, is often quite a bit more than what is charged when they're coming in person to the pharmacy. But this is a great way to kind of launch your initial delivery operations out and be able to collect payments while being distant with the tap function as much as possible. And we're also open to integrating with other payment providers. So if you have one in mind you're already using, reach out to us, and we'd love to chat about that. Now, we offer support. This is Stephanie. She's on our support, one of the team members on our support team, and we support our customers Monday to Friday from 9 to 5 by chat, phone, or email. So you may be familiar with some of our other tools like our narcotic reconciliation tool. It's in hundreds of pharmacies. We're in over 1,000 pharmacies right across Canada. And even outside of 9 to 5, you're able to access a knowledge base of information on our Econoroute delivery software in order to get answers or help that you need. So lastly, before we take questions, I just want to talk about the pricing. So in terms of pricing, how this works is depending on how many deliveries you're doing, we've got 3 different price points. It starts at $59, and that includes up to 250 deliveries a month through the software. And $89 gets you up to 800 deliveries. And we have a couple other plan options as well. Most people fit into one of the first 2 tiers that I have just mentioned. So on this screen on the right, you can see a bit of a preview of what a driver experiences on their cell phone. They can see the next delivery that is up. They can access a map to get directed to that delivery, and they can record a delivery or an attempt or something that's undeliverable. And the pharmacy can track all of this in real time. So if you would like to get in contact with us, you can either do so by hopping on our website here on the slide, or you can reach out to James or Dean and just say that you want an introduction to us over email, and let us know that you saw us on the webinar, and we'd love to chat with you further.
That's great.
Spencer, I think I'd just like to add, it looks like there's one question coming in, but the one thing that I noticed, about the audit trail, and just to comment on that, and James, like myself, we're on the complaints committee here at the college in Ontario, and the number of delivery related, privacy concerns that come in, is truly sort of shocking, I think. So I just wanted to kind of stress the importance to everybody on the call of that audit trail mechanism, that because I could see it being a huge benefit if you were ever challenged, on what your delivery driver did or how he dropped it off, or a privacy concern. So I just wanted to comment on that. And there's two questions that came in, and fire them off to you. How long has Econoroute been on the market, and any success stories?
Yeah, so actually, it's great timing. We just launched this. This newest tool about 2 weeks ago. We've been around for 5.5 years now with our narcotic reconciliation tool and our temperature monitoring tools. But this is a brand new tool that we've released. And we've already got a bunch of signups, and we've got people using it. The nice thing about this tool is from the moment you sign up, you can start scheduling tomorrow's deliveries, and within 10 minutes have tomorrow's run ready to go. So there's very little time to wait to put it into action. It can be done right away from our website. And if for any reason you're not seeing the value that you hope to get out of it, you can cancel right on the platform without even having to reach out to us. It's just a month-to-month contract.
And Spencer, the second one is, any concerns around patient confidentiality when delivering RX products?
For sure, absolutely. So we've got a pretty good history with our experience in terms of compliance. I know a few of the panelists have talked about it tonight. In the US, we've got HIPAA compliance and PIPEDA PIPEDA in Canada. And so there's a whole bunch of different elements of this. We have a designated compliance officer in order to comply with these 2 sets of regulations. So as some of the others mentioned in their softwares, we have similar securities in place. We've got encryption of data. We've got data residency, meaning all of the information is being stored in the proper area, in the proper countries, in order to comply with regulations. And I will add that we have also been tested by some very large pharmacy organizations for our security, where they've tried to penetrate our security network and test it in a whole bunch of rigorous ways. And we've came out with fantastic security ratings and things like that. So we've passed a lot of security tests already in our 5.5 years of operating.
Spencer, I'll give you one question. So when you look at which type of pharmacies are more likely to find value from your product, is there like a typical are there typical qualities of a pharmacy that would make them an ideal candidate for Econoroute?
Yeah, I mean, we used to say when we were talking about deliveries, although this is a new tool, we have touched on some technology in this space years ago, and we used to say it came down to how many deliveries you were completing. Right now, we actually don't put any number of minimum deliveries as a requirement in order to recommend using this sort of software, because everybody right now is in a transition towards more deliveries over time. So really any pharmacy who is offering deliveries, regardless of the volume, whether they're doing 50 a month or 800 a month, it doesn't matter. They're able to grow their operation. Right now, we see a big divide. Even during COVID, we have pharmacies who are completing, let's say, over 100 deliveries a week, and they're typically doing way, way more than that. Or we have pharmacies that are doing under 100 deliveries a week. This is a divide that we've seen so far. And it, lots of times they struggle with, how do we source a driver? Is there insurance we need? Other things like that. So we try and help them through that process, not just the technology, so that we can grow with them. And all of that feedback we get allows us to add more to the technology so that we can offer even more things in the future. We've got a lot of stuff still to come that you don't even see in the platform today.
All right, Spencer, that's excellent point to wrap up on. Thank you very much. So
Thanks
Dean
for
and I are
having
just
me.
going to wrap up the session. So before we go, I just wanted to mention that as well as being a pharmacy banner, WholeHealth has taken on the role of helping pharmacies source PPE and medical supplies. So if you need any assistance with regard to that, you're welcome to send me an email and I'll send you our order form. Dean, I don't know if you're there for any final comments, but I just want to thank our speakers, Michael, Bavash, Spencer, and Ree. That was exceptional. I think we all learned a lot tonight about technology that pharmacy can use to improve operations. Dean, are you there?
James, I just wanted to probably just thank everybody. Thank all four of our speakers, Michael, Bhavesh, Ree, and Spencer. Tremendous. And I think this is one of our best webinars yet. And I got a lot of you sent me private messages throughout the on the content and how helpful it was. So James, thanks for being the glue and putting it all together. And with that, I think we'd just like to kind of thank everybody for attending, and watch out, there's more to come, and we will talk to you very soon.
All right, thank you everybody. Good night.
Good night.